Good morning, everyone. Welcome back to Atlanta and Company. I'm Christine Polaris. So great to be with you today. Well, many of us have questions and concerns when it comes to reproductive health. Luckily, right here in Georgia, there's a facility that specializes in helping bring new life into this world. Reproductive Biology Associates was established in 1983 as Georgia's first IVF treatment center. Joining me today to shed some light on how genetics plays a role in our fertility is Dr. Pavna. Thank you so much. Great to see you as always.
Great to see you.
Well, let's dive right in because we want to talk today about genetics. So how does that play a role in our infertility?
Well, you know, genetics plays a huge role in our overall health. And for couples who have been trying to conceive for 12 months and haven't met their goal, genetics can play a role in ovarian predispositions, uterine issues, even sperm-related issues. So we're learning a whole lot about the impact of genetics on not only health, but infertility.
So therefore, it's so important that when somebody comes to see you, they really give you an extensive background on both parents, right? And that way you can assess, where you are in a starting point, so to speak.
You're absolutely right. We do a full history, including a full family history, to get an idea of any genetic predispositions that we should screen for.
And let's talk about those screenings. What do you offer patients routinely?
So we routinely offer patients screening that looks at any potential carrier states they have. The American Congress of OBGYNs recommends that we use ethnicity to help us with screening.
Good.
For things like cystic fibrosis, spinal muscular atrophy. Sometimes a family history will give us an idea of a single gene we should look for specifically.
Right. I remember I was a carrier, I found out, for cystic fibrosis.
Were you? Okay.
But luckily neither child, ended up having it. But yeah, those tests are so critical. So you know what you're dealing with and you know how to get the help that you need. And let's talk about certain patients who might need additional further screenings.
Right. So some patients come to us for different reasons. For example, they may have recurrent pregnancy loss where they're able to conceive, but they have many miscarriages.
Right.
In those settings, we'll do further genetic screening, looking at both partners and looking at their karyotypes, which is an alignment of their genes to make sure there are no flipped chromosomes or chromosomal issues that could be inherited. Those are rare issues, but can be important to screen for. Also, women sometimes have things like premature ovarian insufficiency, and there are genetic links that we test for there that could help us to understand their predispositions.
And what can be done if these issues arise?
Well, first of all, just like you were mentioning, it empowers us with information about our genetics, things we might be predisposed to, and sometimes even family members need to be notified about genes that are being carried. But we have had huge advancements in vitro fertilization, and we can now genetically screen embryos if that's indicated.
Yeah, talk a little bit more about that. It's just amazing that you can genetically test these embryos. Tell me more about that.
Yes, so, in vitro fertilization, or IVF, is a common procedure that's used to help women and couples with infertility. In the setting of genetic testing, what happens is we give a woman medications, then we grow follicles and put the woman to sleep and extract eggs. We make embryos in the lab and grow those embryos out to a certain stage. We're seeing huge advancements in embryology and the ability to biopsy embryos. We now do that at about the day 5 stage of development, where embryos really survive the biopsy well, and we can basically amplify that information several-fold to get a lot of genetic information.
Wow, that is incredible. So therefore, the genetic testing of the embryos, it improves the chances of success with IVF?
It does. What it does, it's a selection tool for us. So not all people are candidates for genetic screening, but if it's indicated, it helps us to pick which embryos are healthy. They may be embryos that are not impacted by the specific disease we're looking for, or they may be just embryos that have normal chromosomal alignment that have the highest chances of implanting.
Oh, that's wonderful. And you mentioned the right candidate. How do you go about assessing that?
That's a great question. So while the technology is available, not everyone's a candidate and not everyone has an indication for its use. Certain genetic predispositions can bring us on that way, or people who have a higher rate of what we call aneuploidy, or abnormal chromosomes in their embryos. Sometimes women have low egg reserve and may have a lower pool of embryos to test from. So those women may not be great candidates for genetic screening because we are looking at having a good pool of a good number of embryos as well as healthy embryos to test. But it really does matter case to case.
And I imagine with so many of us starting families later in life, over the last few years, have you found that the people that are going through IVF are older or not necessarily?
The women coming to us for initiating care are definitely, we're moving to an older age when we're starting our families. And that's a societal trend. You're absolutely right. In the 1970s, families were starting in their 20s, and most women had completed their childbearing years in their 20s too. But now many women are starting their families over the age of 35. So the rates of abnormalities and aneuploidy and risks all need to be factored in.
Right. Well, I know you do a wonderful job. I know it's been, you know, last year was over 30,000 babies. I know it's so much more than that now. So we appreciate everything you do to help families get the families that they want. So thank you so much.
Thank you. Thanks for having me.
And if you would like more information about Reproductive Biology Associates, give them a call, 404-257-1900, or log on to the website. It's rba-online.com. And this segment was paid for by Reproductive Biology Associates.